Hello. There are many reasons that infection and vaccine-induced immunity can differ. But first, I'd like to introduce what does immunity mean. So on the left side of the screen shows the immune response, and immunity can mean sterilizing immunity, such as the top, where you prevent any viral reproduction, or it can mean preventing symptomatic or severe disease, such as those near the bottom. So infection and vaccination on the right shows some of the strengths and weaknesses. So infection has a wider breadth of the immune response. It may have improved mucosal immunity, immunity to diverse targets of the virus. However, the response appears to be more variable depending on factors such as the severity of disease. Vaccination appears to provide a more predictable and consistent immune response, and at least for the mRNA vaccines, gives consistently higher titer antibodies compared to post-infection. But it does seem to have a limited breadth of response. It's only to the spike protein and appears to have earlier waning of immunity. This is results of an in vitro study. There are many similar to this, but on the top, it is showing neutralizing antibody titers against various combinations of vaccines. And I'd like to focus on the neutralizing antibody titers towards the Omicron variant, which is on the furthest right in red. So whether it's Moderna, Chadox, Pfizer, some combinations, you can see there are quite good antibody titers against the Alpha, Beta, and Delta variants, but poor against the Omicron. If you look at the bottom, these are convalescent plasma after infection with the Alpha, Beta, Delta, or some with hybrid immunity. So you could see on the bottom left, in the E here, you have those that are infected with Alpha have good Alpha antibody titers. Those that are infected with Beta have good Beta antibody titers. These are, again, neutralizing. And then Delta have good Delta neutralizing antibody titers. But all of these groups have very poor neutralization against the Omicron variant. In the bottom right, in this panel H, you can see those that were either infected and vaccinated or vaccinated and infected have excellent titers against both Delta and Omicron, suggesting that a hybrid immunity gives the best titers. Now, more recent data has shown similar findings for Omicron, that post-Omicron, there's good Omicron neutralized antibody titers, but quite poor against Alpha, Beta, and Delta. And there is emerging data suggesting post-Omicron infection with the initial Omicron variant is poor against some of the more recent subvariants, such as BA4, BA5. And I'll briefly talk about cellular immunity as there's limited data on this. But on this slide, first on the left, so this is showing cellular immunity as measured by an interferon gamma ELISpot assay against spike responses. So on the left here, you have prior infected, and then green, you have vaccinated, and then hybrid immunity on the right. And a couple of things to notice. Here you don't see any huge differences, but maybe slightly higher for infected versus vaccinated. Probably even more importantly is when you compare the wild type, or WT here on the left, against the Omicron cellular responses, you can see that there is not nearly as much as a drop-off as we saw with the neutralizing antibody titers. And you can see hybrid immunity also seems to be similar to slightly better. However, if you look at the non-spike, you have the nucleocapsid membrane envelope cellular immunity, you can see, again, that wild type versus Omicron, virtually no differences. And for vaccine, as expected, for non-spike cellular immunity, it's quite poor. And again, hybrid immunity seems to be quite robust. On the right here is showing cellular immunity pre and post booster dose, both those that had been previously infected or not. And even in those who are previously infected, you see very increased cellular immunity responses post the booster dose. And this includes Omicron-specific spike targeted cellular immunity. Looking at waning over time, so we are now moving to epidemiologic studies. So this is a study out of Israel. On the top, we look at, here are rates of confirmed infection per 100,000 risk days. And in the top panel here are those that have been infected or recovered. And you can see the further down you go, the longer it has been since they've been infected. And you do see some waning over time, that you have higher infection rates among those that have been infected further back in time. But you compare that to the vaccinated group here in the middle, and you can see that even just 6 months, 6 to 8 months from a primary vaccine series, that the infection rate is quite higher, representing quicker waning compared to infection-induced immunity. And a booster dose does bring the rate back down quite a bit, but other data will show that the booster dose also shows some waning. If we look at hybrid immunity at the bottom, both those that were first infected and vaccinated, or then vaccinated and then later infected, that one, the rates are lower. We do see some waning, but similar to infection-induced immunity, it appears to be a slower waning. On this slide on the left, we are looking at an epidemiologic study conducted by CDC in conjunction with the California and New York Departments of Health. And we are looking at cohorts and the hospitalization rate and case rates over time for COVID-19. So on the left here, we have hospitalization rates during 2021. This is definitely pre-Omicron. It goes to October. And we see that in the top here, these is the cohort that didn't have any vaccination or hospitalization at the beginning, having much higher hospitalization rates. And at the bottom, whether you have been vaccinated, infected, or both, the rates are much lower. If you look closely, you can see that the lowest rates in this darkest color are those that have been both infected and vaccinated, followed by those that had only been infected, and slightly higher rates for those that had only been vaccinated, suggesting that infection-induced immunity during this time was slightly more protective than vaccine-induced immunity. Hybrid immunity was superior to both. And the case rates on the right show the same. If you'd like to look carefully, I'd say look at these cumulative incidence numbers in the parentheses at the right. But for time's sake, we will move on. This is a study out of Israel, and it's a large retrospective study looking at, among people who were previously infected, what was the risk of infection depending if they were vaccinated or not. So among people who are infected, one Pfizer vaccine dose reduced the risk of infection. On top are younger patients, age 16 to 64, and it was 82% lower risk. And among elderly patients, it was a 60% lower risk. So demonstrating that if you have been infected, there is a decreased risk of infection. And since it's been published, the CDC has also shown this for hospitalization as well. This is a study from the United Kingdom, and it shows the waning of vaccine-induced immunity compared with infection-induced immunity. So on the left, we have those that are without previous infection. And we could see that even just 74 days, a few months after vaccination, that the adjusted vaccine effectiveness goes from approximately 90% down to about 50%, so waning pretty quickly. Among those with previous infection here on the right, we look at these gray dots here on the left. So on the top are those that were recently infected within the last year. And even if unvaccinated, protection appeared to be between 80 to 90%. If you were infected more than a year ago, that drops to about 69%. But for both these groups, whether you're recently infected or more remotely infected, if you were vaccinated on top of that, compared to the waning we saw with those that had no previous infection, this hybrid immunity, we see very little to no waning over time, even up to close to 3/4 of a year. So I'll focus on Omicron studies for the remainder of the presentation. The overall risk of reinfection increased during the Omicron wave. In the United Kingdom, they reported that the vaccine effectiveness against infection with Omicron was only 0 to 19% following a 2-dose vaccination, and that's combining both the AstraZeneca and Pfizer vaccines. If you added a third dose, a booster dose, it increased to 55 to 77%. And for those with a history of prior infection, it was only 19%, so much lower than the data I showed on the last slide. New York has a tracker for their reinfection data. And we could see that after Omicron became the predominant source, we see a big peak in reinfections, as they were quite low before that. And at this point, over 85% of reinfections have been reported since Omicron. This data continues to be updated. A preprint out of the Czech Republic looked at protection from infection or vaccination, or both against Delta and Omicron. So the first slide here is against protection against infection. I'm going to focus on the blue dots in the top chart here. So if we look at those who were recently infected within 6 months, they had protection close to 70%, but it waned close to 12% for more remote infection after 6 months. With the 2-dose vaccine series, which included both the mRNA vaccines and the AstraZeneca, if they were recently, it was a little higher, but still below 50%, and quickly waned after 2 months to close to 10%. While those that were boosted or briefly had protection above 50%, but again, even after a boost, it waned to 20%. At the bottom are various combinations of hybrid immunity. And we do see superior protection against, this is all Omicron on the bottom, with hybrid immunity, but we do see waning. For example, those that were infected and vaccinated, but vaccinated over 2 months prior, we could see that if the infection and the vaccination time had passed, it lowered to 45%. And even if they were boosted, if they had a more remote infection and were boosted more than 2 months ago, protection against infection was only 48%. And this slide is from the same study, and it shows the data for protection against hospitalization. So on the top, we have just vaccination with a booster or infection. And you can see that there is poor protection against hospitalization against Omicron if you just have a primary series. If you have a booster, it does boost, and there may be some waning as quick as 2 months afterwards, which is similar to other studies that have been published since this. For infection, no waning is seen up to 6 months afterwards, but we do see with hybrid immunity, we have superior protection and no clear signs of waning for those with hybrid immunity. A study from Qatar has shown similar results. Although this doesn't have waning, it does show superior protection against hospitalization. This looks at BA1 and BA2 infections. So on the left, we have BA1 infection and BA2 infection protection. And the highest are for those that have 3 doses and prior infection, followed by those with 3 doses or those with 2 doses and prior infection, or just prior infection. And then those with just 2 doses with pretty poor protection against infection. On the right is protection against hospitalization and death. We see very high rates of BA1 for all groups against protection against hospitalization and death. For BA2, slightly lower for those that have either just been infected or 2 doses, very high for those that either have a booster or have hybrid immunity with 2 or 3 doses. So this was a quick whirlwind, but in summary, SARS-CoV-2 infection can cause severe disease, death, and long-term morbidity, whereas COVID-19 vaccination is safe and effective at preventing severe COVID-19 disease. A history of infection appears to provide protection that is at least equivalent to primary series vaccination. And immunity following both vaccination and infection wanes over time. But both a primary series and a history of infection provided much lower protection during Omicron than during prior COVID-19 waves. Vaccination can boost the immune response in a previously infected individual. And hybrid immunity appears to be long-lasting and appears to have resulted in a greater ability to neutralize Omicron than either infection or vaccination alone. Thank you.